Good evening, friends. Dr. Rajamahendran, your NEET SS surgery faculty here. I welcome Dr. Alan, a topper, rank 22 in NEET SS. So, good evening, Dr. Alan. Please
Good evening,
introduce
sir.
about yourself. Please introduce about yourself.
Hi, my name is Dr. Alan Joseph. I did my MBBS from MOC Medical College in Kolanjeri, Kerala. And then I did my MS from KEM Hospital, Mumbai, in general surgery. And I passed out in 2023, and now I've given NEET assessment. Yeah, planning to want to do GI surgery. That is what I like.
Great,
But yeah,
Dr. Alan. From since when you have started your preparation? From 2023 or from last few months?
sir, actually, from after I passed out 2023 of November, December. Actually, the
Okay,
MRCS after the MRCS exam around
okay.
January, yeah, 2024 January. That would be the time I properly started.
That's great. That's great, Aaron. So, can you tell about the source of materials you used for your preparation? So, what are the source of materials you used? What are the books you prepared for this for getting this great rank? So, please tell about those things which will be helpful for the juniors.
Okay, sir, what I started off with, I had taken DocTutorial, the video subscription, and I
Uh,
started seeing videos. And then the first, what I did was I saw the videos and then made notes from the videos. I always prefer to make my own notes because I'm
that's great.
not comfortable with using other notes. So make my own notes, and then after the videos, I actually go back, sir, as you had only taught in your videos to go back to Sabiston and go back to Bailey. So I made my
Okay,
notes from the classes, and then I used to read Sabiston and Bailey after that because it actually I felt it helped me understand better because you had already explained how it is done, and then it was easier to read it. And then any
yes.
points I felt could be added on, I added to those notes, and then had a final notes after that. A few subjects towards the end, I actually learned directly from the doc tutorial notes, the ones printout notes. But the major subjects like urology, GI surgery, and general surgery and vascular. Many of the things I made my own notes, except for the end few small topics.
Okay, okay.
Uh, yeah. And these are
Super.
the main sources I used. And for some chapters, again, like I said, few tables from shorts, but the main thing was Sabiston Bailey line to line. That
That's
was
great. That's
something.
great. You read Sabiston full book.
Yes, sir. Sabiston full book.
That's great.
Uh,
Great.
but
It's a
sir,
great
I
thing.
didn't learn. I added those notes to my main notes. So in the end, I only had to read
Okay.
notes. I didn't have to read the whole book again.
Okay.
So
So, did you use our Q banks from DocTutorials?
yes, sir.
Did you use those Q banks? How was it?
Yes, sir. Sir, it was very elaborate. As in, it took me
Uh,
some time to complete it. But yeah, it was. I used your Q banks. There was an image-based Q bank, which is actually very helpful because that it only
okay,
had images. That was very
that's great.
helpful. And what I did with the Q bank was I solved the entire Q bank in the first go, and then I
O-
bookmarked the questions, not just what were wrong, but think topics which I could forget, which is not there in my notes. And
Okay,
then
okay.
for my revisions, I only looked at the bookmark ones. So that is what I had done.
Super. So great to hear, Aaron. So, what advice do you want to give to the juniors who are preparing for this exam in future? Because
So
uh,
yeah, the advice I
because it's a
would give
highly
is
competitive exam, you know very well.
yes,
So, it needs a lot
yes.
of patience to get a rank. So, definitely, you might have appeared for previous exam also. You might have not. What is your rank in the previous NEET SS?
So
This is
actually,
the
the
first.
previous yes, sir,
Uh,
previous NEET test was on the day of my marriage, so I couldn't
okay.
write it. Yeah.
You're gonna try. So this is so definitely there will be some difficulties in preparation. No, so
Yeah.
many students they drop out this SS preparation and go and start their practice with the, as a MS general surgery itself. So
Yes, sir.
what motivation do you want to give to those type of people who are preparing for this SS?
So the motivation I would like to give is uh, see, in the thing, it is something which is achievable. It is very achievable. I'm not some extraordinary brilliant student. I'm an average, an above average student. And if I can do it, it is proof that anyone can do it. Some people are very smart. They might have to only read maybe two times, but some people are not so smart like me, and we might have to read four times. But the difference
Yes,
is, whatever is the difference in the smartness can be made up with hard work. Only advice
super.
is your notes, yes, the faculty will teach you, but in the end, you will have to read Sabison on your own. You will have to read Bailey on your own. Read it, understand it, and if you do it again and again, I think it's achievable. There's nothing, yeah,
Super.
I think,
Great, Dr. Allen. Thank you so much for the interview.
thank you.
So, final
Thank you, sir.
compilation from Dr. Allen is he has prepared. his own notes. That's the most important thing here. He has prepared the own notes using DocTutorial videos. Though there is a material available from DocTutorials, he has made his own notes. He felt comfortable with his own notes, and that helped him to add up extra points. And it has had made him confidence towards his preparation. So, how many questions did you attend, and what is the marks you got, Dr. Alan?
Sir, I attempted 140 questions.
140
10
questions.
questions I left. And thing was because it was the three sectioned, I was not sure on how much to leave. And
Okay,
my
okay,
third came out first two only like two questions each, but the third section was a bit difficult for me.
okay,
Sir, and
okay,
I think I got 470. I think 474. I'm not sure, sir. I have to
okay,
check,
okay,
but I
okay.
think it's 474 around that is what I
That's
got.
great. That's great. So
Yeah.
great, Alan. Your method of preparation will definitely help the juniors to make a plan. Thank you so much for the interview. So much.
Thank you so much, sir. Thank you,
Thank you.
sir.
Thank you. Thank you so much, Alan. Thank you. Bye. Bye.
Thank you, sir. Bye. Bye, sir.